Hi, it's Christina with the Sisyphean Journal. Today is April 3rd, and I have already covered today's anniversary. It's one of two victims of a physician abortionist in 1936. And remember, pro-choice logic had nothing to do with the lack of antibiotics. Even if there had been antibiotics, she still would have died because the legalization fairy hadn't been there. So you can follow the link to her story below. But buckle in, we have a rough ride. We are going to look at a lawsuit that Life News brought up. And it is a nightmarish story of abortion quackery, but fortunately, unlike other women sent home with huge parts of their babies left inside them, this one ended with only one fatality, the baby. Now, none of the sources give the woman's name. They're protecting her privacy, but I hate the dehumanizing feel of just saying a woman, the woman. So unless or until she chooses to reveal her own name, I'm going to call her Davida in honor of one of the women abused by abortionist Kermit Gosnell and featured in their excellent documentary 3801 Lancaster. And I'm going to link to 3801 Lancaster below. It is a must-see for anybody. So the information I use is from an expert review of the case provided by Secular Pro-Life. If you are watching this on Rumble, you can follow the link below to my entire post, and it has all kinds of links in it to sources. If you're watching this on YouTube, you can either pop over to my channel on Rumble, or you can go to realchoice.blogspot.com and look for abortionist removes less than half of unborn baby, and you'll find it. So, the first steps at the facility. Davida had undergone an ultrasound on March 7th of 2023, and she was found to be 18 weeks and 5 days into her pregnancy. A little under a month later, April 1st, she went to Equity Clinic at 2111 West Park Court in Champaign, Illinois. This is the wokest abortion clinic I've ever seen if you go to their website. I don't know what the equity is. Are they planning to proportionately kill as many white women as they do black women? Based on the prior ultrasound, evidently without doing their own ultrasound, Dr. Keith Reisinger-Kindle estimated the baby's gestational age to be 22 weeks and 2 days. Now, Davida was given whatever particular counseling that the clinic considered adequate and signed a consent form. And among the possible complications listed were hemorrhage, infection, and injury to her own internal organs. And if you're on Rumble and you follow the link, I also provide a link to the clinic's patient information video, so you can decide for yourself if you think Davida and other patients are giving adequate information about what they can expect. Reisinger-Kindle then numbed Davida's cervix and inserted 4 Dilapan synthetic cervical dilators. So instead of using the seaweed sticks, these are made out of, you know how the modern baby diapers, the baby pees in them and they puff up and get bigger because the synthetic in the diaper absorbs the fluid. That's how these work. And everything seemed to have gone well after he inserted the dilators, so Davida was told to return the following day for her safe legal abortion. So she came back to the clinic at 9 o'clock the next morning and reported having no problems overnight. She wasn't taken back to the procedure room until 10:18 a.m. She was given conscious sedation, and Reisinger-Kindle suctioned out the amniotic fluid and then used Sofer forceps to dismember Davida's unborn baby under ultrasound guidance. And if you're on Rumble and you follow the link below, I do have a picture of Sofer forceps. Now, according to pro-choice hero Leroy Carhart, in his testimony about a prospective partial birth abortion ban, when using ultrasound guidance to perform these dismemberment abortions, not only does the doctor see the baby so he could tell what part he's grabbing and pulling off, he can see the heartbeat while he's killing the baby by ripping it limb from limb. Now, if he had even marginal skill, Reisinger-Kindle could have seen what he was doing to the baby and how much of the baby was still left to be removed, not to mention he's putting pieces on a tray next to him and should, and at least in theory, be able to count. He completed his use of the forceps, finished up with the suction curette, and concluded that the uterus was empty. As we will later learn, the uterus was empty, but the little tray he was putting the parts on was far from full. So, Davida was given medication and uterine massage to control the bleeding, and she was sent home. Well, the first sign of trouble was the next day at around 11:30 in the morning when Davida called to report heavy cramping. She was told this was normal, take some over-the-counter pain meds. 5 hours later, she called again to say that the ibuprofen was helping a bit, but her bottom had a lot of pressure and it was hard to breathe. Now, this should have been an immediate go to the emergency room. Any trouble breathing, you go to the emergency room. Nope, just, whatever. They transferred her to Reisinger Kindle. He did not document any conversation with her. So the following day, April 4th, Davida called to say that she'd taken 2 doses of a laxative and was experiencing increased abdominal cramping, but still hadn't had a bowel movement. So the clinic suggested that she try an enema and then seek urgent care or an emergency room if there was no improvement. And just as a little aside, Morris Helen Herron, when her abortion was botched, she was told to take a laxative, and she ended up dead. So Davida was indeed fortunate here. Later that day, Davida's mother called to say that her daughter was at the hospital and being brought into surgery. So what did they find in the hospital? Davida had arrived at the community hospital emergency room in Indianapolis reporting lower abdominal pain. A CT scan of her abdomen found a partial fetal skeleton atop the uterus and free air in her abdomen, indicating an infection, so 2 doctors took her into surgery. Now, operative notes describe what they found. And this is gruesome, so you might want to skip ahead a little bit if you can't handle gruesome, but if, this is what an abortion does. Quote, the patient was found to have half of a deceased preborn human being in the right pelvis of the patient with evidence of severe and intentional trauma. The baby's body was transected at the pelvis, pulled in half, with no legs or feet present. Stumps of both femurs extended from the soft tissue of the torso. The upper extremities were missing from the elbow distally on both sides. The skull was crushed and no brain was present. The face was non-recognizable. There were small bony fragments in the mother's pelvis. Yeah, you can tell the doctors were not really happy about what Reisinger Kindle did. There was a hole in Davida's uterus only about the size of a quarter or $50, and the baby's skull, typo, was stuck to the upper part of Davida's hip bone. So surgeons removed the mangled remains of Davida's baby and repaired the hole in her uterus, and she remained hospitalized for 5 days. She was discharged on April 9th. But seriously, what is this guy's excuse? At 22 weeks of gestation, a baby is about 11 inches crown to rump. Okay, so here's a ruler. Here's 11 inches, okay? From the top of the baby's head to the bottom of the baby's butt is that big. Okay, we're not talking the baby size of a grain of rice. And if I include a picture below of a 22-week preemie so you can see how big a baby he was dealing with, pulling some of the child out and shoving the rest through the hole in Davida's uterus. How did he manage to get only half of each arm, 2/3 of each leg, and maybe some intestines and other internal organs, and not notice that he had shoved the rest of the baby through a hole? If he settles out of court, we're never going to hear his excuse. And he's not alone. This seemingly inexplicable ability to distinguish between an entire aborted baby and just a bunch of chunks is not unique to Reisinger Kindle. Some of the abortion deaths involving this slovenliness are deaths that I have covered. If you're on YouTube, I'll link to just the YouTube stories below. If you are on Rumble, I'll also have links to the Real Choice blog if I don't already have a video about this woman. So we can look at erstwhile criminal abortionist H. Benjamin Munson. He removed only the left leg, right arm, part of the skull, and part of the front of the torso of Linda Padfield's unborn baby. A typical 5-month fetus weighs about 360 grams. He left 240 grams behind, nearly 2/3 of the baby. And Linda died from sepsis, and Munson went on to send teenage abortion patient Yvonne Mestiff home to die of sepsis as well. Hector Savalos at Hope Clinic for Women diagnosed Barbara Lee Davis as 11 weeks pregnant and performed a suction abortion. After he sent her home to die, an autopsy found the face and spine of her fetus embedded in a tear. She'd been about 16 weeks pregnant. And I'm going to pause and look up how big that baby is. Okay, that baby would have been about this big, crown to rump, about the size of the palm of your hand. So spine maybe that big. Maybe you should have noticed, especially since the face was still attached. Probably should have noticed that you hadn't gotten it. And Barbara Lee is the first confirmed death I know of at a National Abortion Federation clinic after that trade group opened in 1977. Dr. John Blodgett sent Maria Gomez home with the severed head of her unborn baby embedded in a gash in her uterus, and she quickly bled to death. Dr. Andrei Norareov sent a woman who identified in medical board documents as patient E home with the caveat that she might expel some tissue. The lab report from the abortion indicated that he'd only removed some placental tissue, and an autopsy found a portion of her unborn baby's left leg protruding from the uterus. Doesn't make it clear whether the left leg was poking out and the rest of the baby was still in there, but considering that he only got placenta, likely, how could you not notice that you didn't get the baby? A woman I've given the pseudonym Linda Hoffman traveled from her home in Indiana to New York to take advantage of the safe and legal abortion. The doctor who performed her safe and legal abortion poked a hole in her uterus but left the dead fetus there. He didn't notice he didn't have the baby, and she died. Dr. Armida Zapeta pushed Maria Ortega's fetus through a hole in the back of her uterus, concluded that she hadn't been pregnant, and sent her home to die. Janet Foster was only 18 when she had an abortion performed by Richard Neal at Valley Doctors Hospital in North Hollywood. After she was sent home, she collapsed, went into seizures, and died. And during the autopsy, the medical examiner found, quote, a macerated, lacerated, and purulent male fetus of about 19 weeks gestation. This fetus, which measured nearly 6 inches in crown rump length, showed lacerations in the shoulder area, evisceration of the bowel through an abdominal laceration, and destruction of the skull and facial structures. So you would think maybe he would have noticed. And a witness at Dorothy Mazzario's apartment found, after her abortion death, found her fetus in a wastebasket. She'd been assured that her post-abortion bleeding was just her period, but in fact, the doctor at Women's Aid Clinic hadn't removed the fetus, and Maria Lira was sent home with her entire decomposing fetus still in her uterus. And there are scores of other cases I know of that refer to retained tissue, but retained tissue can refer to anything from a little bit of placenta to, as you've heard some of these descriptions, the whole fetus. And then I have 2 cases where the doctor knowingly performed an incomplete abortion, resulting in the patient's death. 16-year-old Rita McDowell was sent home with a macerated fetus still in her uterus, and an investigation after her death found that Dr. Robert Sherman actually performed incomplete abortions on purpose so he could charge more for aftercare. And according to Betty D'Amato's family, James Franklin at Abortion Clinic of Denver knew he hadn't removed all the fetus. He sent her home with a trash bag, telling her to collect whatever she expelled. On the autopsy, the medical examiner found a partially truncated and macerated fetus protruding headfirst through Betty's cervix. So DeVita is indeed fortunate to be alive. This was a hot mess. But again, baby's this big. You pull off a few parts and call it a day. Tell me that they really do care about the woman's well-being, because I'm not seeing it.